For your health now, it is a fifth cause of death and a leading cause of disability in the United States. We're talking about strokes, and there are certain factors that put people at risk. And with today being World Stroke Day, Dr. Amir Hassan from Valley Baptist joins us with more on how you can keep yourself healthy. Thank you, Dr. Hassan, for joining us.
Oh, my pleasure.
So let's just talk about the signs of someone having a stroke.
So the American Heart Association created a great acronym called FAST. So face, any facial weakness. A is for arm or leg weakness. S is for slurred speech. And then T is time to call 911. So those are the most typical signs of a stroke.
And what are some of those risk factors? I know there are some risk factors that affect a lot of people here in the Valley, with one of them being, high blood pressure.
Of course. So the Valley has higher rates of diabetes, hypertension, and obesity compared to the rest of the country. And all of these increase your risk of stroke. So we recommend patients control their sugars, continue to see their doctor annually, semi-annually, make sure they control their blood pressure, eat healthier, try a little bit of diet and exercise, which is sometimes hard to
Especially with Halloween around the corner. And there's actually a specific stroke treatment that you do at Valley Baptist that you are the only person who does it in the Valley.
Yeah, so at Valley Baptist in Harlingen, we can do the endovascular treatment. So it was recently proven positive and effective in the New England Journal of Medicine a few months ago, and we were the only site in Texas that was enrolling into the trial. Basically what we do is we take little catheters through the groin, go up and find the clot, and then we actually pull it back under some suction. And these patients have done very, very well compared to previous data.
Yeah, and you were mentioning some of the things that people can do to lower their risk, and are there different types of strokes?
Yes, there's a hemorrhagic stroke, which is a bleed in the brain. That's typically due to high blood pressure or some drug use, or a malformation. So some patients will have these malformations between the artery and the vein that we could treat. We just recommend them to come see us. Ischemic stroke, which is a blood clot in a blood vessel, is the most common type of stroke, 87% of stroke. And even though now it's the fifth leading cause of death, in the world it's the second leading cause. In Mexico, for example, it's the second leading cause of death. But it's the number one cause of disability across the world.
And I guess those disabilities do range, so there are people who could recover.
Correct. Patients can recover, but they might be wheelchair bound, bedridden, nursing home, placed in a nursing home. So our goal is to try to get them to be fully functional, not just give them some medication and get them to be in a nursing home. We want to actually get them fully functional, completely independent, so they can bathe themselves, feed themselves, take care of themselves. That's the ultimate goal of every stroke treatment.
And how many patients would you say you see maybe in a month that have suffered from a stroke?
So we see about 550 strokes a year in our hospital, which it's an okay number. Some hospitals across the country see 1,000 or 1,500 a year. The big thing for us is the percentage of patients treated with IV TPA, the IV clot buster. Across the country, it's about 3%.
Wow.
We were able to raise that across over the last few years to about 12%. And if you add the endovascular treatment, we treat approximately 23% of our strokes, which is much better than 3%, which is the average across the country.
And doing that certain treatment just helps the patient with their chances of recovery.
Yes, because the clot buster is only FDA approved for 3 hours. So with this endovascular treatment, we can expand that time window, and we have some fancy imaging that we can do and see what tissue is damaged and what tissue is salvageable. And if it's salvageable, we'll go in and pull the clot out.
And just one final thing, we mentioned it is World Stroke Day, so what's a final tip that you can give to people out there to make sure that they avoid having a stroke?
So I would recommend eating healthy, diet, exercise. The main thing is try to remember the FAST acronym and at least teach it to one other person. So FACE is for facial weakness, arm or leg weakness, S is for slurred speech, and then immediately call 911 and get to your closest primary stroke center.
All right, well, thank you so much, Dr. Hassan, for joining us this morning.
Thank you.